My name's Jacob Lane Dickinson. I'm a board-certified general surgeon and a fellowship-trained trauma surgeon and surgical intensivist. I did my undergraduate at Texas A&M University. I did my medical school at Auburn University, surgical training in New York at Stony Brook, which is a level 1 trauma center. And I did my fellowship in surgical critical care at Baylor University Medical Center in Dallas, Texas, which is an ECMO Platinum Center. I became a doctor for the simple fact that I wanted to help people. I grew up around a lot of strong and selfless individuals that showed me early on that strength isn't really about just what you can do for yourself, but really what you can do for others. I came to find myself working at Valley Baptist because I'm from the Valley. I grew up in McAllen. I always knew that I wanted to come back here and make an impact. And what Valley Baptist is doing sits very on point with exactly what my philosophy is. They're coming in, they're doing the work, and they're trying to make a real difference. What led me to my specialty, specifically in general surgery, the vast and broad aspect of it, being able to take care of a patient that walks in the door and you're able to take care of them from the medical perspective, the surgical perspective, take them to the operating room, and then take care of them afterwards, I think is very rare in all medicine, really. You're able to help somebody that you didn't think you were going to, and then being able to share that news with their loved ones, it's a big deal, and not everyone really gets to experience that. And then from the trauma and the critical care perspective, I've always been drawn to taking care of the people that are most at need. I've always really thrived in a chaotic environment, so it was a natural progression for me to kind of go into these fields. The way I try to get my patients involved is letting them know that they're in charge. Like, they're the captain of the ship. I'm there to help and guide them figure it out. But ultimately, everything that we do is their decision. Being able to have physicians and surgeons and specialists that are local in the Valley are a huge help. I mean, I remember when I was younger, if you had a really sick illness or you had a pediatric issue, the closest place was San Antonio. So being able to have somewhere that's 15 minutes down the road versus 4 hours down the road, not only is it a benefit from a financial perspective, but it also keeps families together. Being able to have your brothers, your sisters, your tias, your abuelas come to the hospital and be able to see you, having the support from your family is just as important as the doctor you pick. So having that stuff nearby it's huge. Being able to work with a group that is so well trained and so well versed and so many broad different techniques and skills and pathologies, it doesn't matter whether I'm in there or my partner's in there, because we can get the job done. Nobody wants to come to the hospital, but if you have to come to the hospital, you want to go somewhere that they're going to care about you, they're going to treat you with respect, and they're going to have the knowledge and the skill to do whatever you need. And I think myself, along with the group that I work with and the institution at Valley Baptist, can provide all those things.